Well, hello everybody and welcome to our webinar today, Bring Your Interventions to a New Dimension. We're David and Christina from SpellBound, and we're happy to have you all here and excited to get to share a lot of really helpful information with you today. So before we get started, have just a couple housekeeping items that will help us make sure everyone's ready to go on the platform we're using today. So we're using GoToWebinar for this web session. If you're joined already, that means that you've completed a lot of the steps already. So good work. On your screen, you should see a GoToWebinar control panel, which is how you're going to interact with us during the session today. So if everyone can hear us, go ahead and raise your hand, and you can do that on the GoToWebinar panel. The hand is a little icon on the left side of that control panel, and it's underneath the red microphone button. Okay, and I see some hands going up, so it looks like people are hearing us, which is great. Okay, so a couple more things about the GoToWebinar tool. First of all, you're going to be able to ask us questions during the session today, and in fact, we would definitely encourage it. We have Anna from SpellBound is here, ready to answer questions, and so you'll see in the panel, you'll see an area titled Questions, and at the bottom of the area, there's a little box where you can type in your question and then send it. That'll come just to us. And then if we can respond to it just to you, or if we think it would be helpful for the other attendees to hear about too, then we can respond to it in a way that everyone sees it in the chat window, or actually be in the questions area for you. So it won't have your name on it though, so it will still stay anonymous. We're going to try to answer all of your questions during the webinar, and we'd love to hear them, so please fire away. We're also going to share out a list of the questions as a follow-up to the webinar so that you can get even more helpful information to take away from today. This webinar will be recorded, so you'll be getting a link to access the recording of it. And so if one of your colleagues also missed this, potentially you can give them that to follow up, or they can get it in their registration follow-up email. And you're all on mute, so if you do want to communicate with us, make sure to send that question through the GoToWebinar questions feature. The last thing I'll cover, and then we're going to jump into getting started, is the handouts. We're really excited to provide some really valuable handouts that our team has put together for you, and those are in the handout section on your GoToWebinar panel. It should be right above the questions, and there's two handouts in there: an AR VR primer and a SpellBound AR Tools Value Justification Guide. So both of those have super helpful information, and make sure to click on those. They'll open in your browser and you can download them from there. All right, with that, let's jump in and get started. I've been talking this whole time here. With me here is Christina. And Christina is the founder and the founder and CEO of SpellBound. She is SpellBound in some ways, and she started SpellBound because she felt like there's really a higher purpose for technology in engaging kids in positive ways. Christina drives the product vision here, and she's worked with many certified child life specialists and other therapists and lots of hospitals to learn about their needs and to really understand their needs in a way that helps us to build product that helps you help your patients in really profound ways. Christina has 15 years of experience in the software industry, building tools for higher ed and for hospitals, so she's really a technology expert. And she's also a big sci-fi fan and loves to read to her daughters. So with that, I'm going to hand it over to Christina.
So I get to talk now, and I get to introduce David. David is Chief Relationship Officer at SpellBound, and this means that it's his job to talk to hospitals around the country to learn about the needs of their teams and the unique challenges that they face. He helps them to learn about SpellBound and how that can help deliver a better patient experience. Before coming to SpellBound, David managed software implementation at higher ed institutions. He's a big fan of riding his moped and eating Korean food, but not at the same time.
Sometimes. No, I'm just kidding. Safety first, folks.
So one of the reasons we wanted to do this webinar is because we have the benefit of talking to a lot of people in hospitals: physical therapists, child life specialists, physicians, hospital executives, patient experience people, and more. We hear about the perspectives of each of these people and have learned a lot. And so we want to share some of that knowledge with you so we can help your team and your hospital, because we are also advocates of your profession. As a mother, I've personally felt the benefit of child life with my own children. At the end of the day, the most important thing is the benefit of how can we help patients. You're the ones that work with these kids every day, so we're going to do what we can in this webinar to help you do that important work.
before we move on from the slide, that's me on the left there, Christina in the middle. On the right, that's us sweltering in the Las Vegas heat at the ACLP conference last May. So that is us. And so what are we going to cover today in this webinar? We're going to start by defining AR and VR, kind of in a basic definition to start with, and setting some context for why learning about these 3D technologies is important for child life teams right now. We're mainly going to focus on virtual reality and augmented reality today in this session. That's because these are two of the most common 3D technologies that are used in children's hospitals right now. We're then going to talk a little bit about how augmented reality and VR, kind of specifics of how they're being used, what value they provide, and the benefits and challenges of these tools. We're also going to spend time after that discussing best practices for implementation. So if you decide these tools would be a good fit for your team, how can you implement them in a way that makes sure that you're really successful? And lastly, how can you also advocate for funding for these tools if you think that they're going to help your patients? And we're going to end with kind of where is technology going, a look to the future, and with a challenge for you. Right before we transition to our open Q&A. So stick around for the whole time. We have lots of great info. And remember, send in questions throughout the presentation because we love your questions. Anna's here, ready to respond to them, and we'd love to hear from you. So jumping in, kind of why are hospitals even considering spending money on augmented reality and virtual reality tools today? And those, we're going to refer to those by the abbreviations AR and VR, just because it's hard to say those a lot of times. So I wanted to give you a couple stories to think about to kind of frame the problem or the opportunity for virtual reality and augmented reality. So think about a young oncology patient, and we'll call him Danny. He doesn't want to do his physical therapy exercises, and so he's kicking and screaming, and he's biting to fight it. And if you're a child life specialist or involved with child life or just spend time in hospitals, you've probably seen this before. This may be something you even dealt with this week. And his child life intern uses an augmented reality card to motivate him in that moment and turns the situation around, and Danny is transfixed by the elephant that's sitting in the palm of his hand. And the child life intern and the physical therapist work together and use those augmented reality tools to get Danny through the rest of his PT session and to have him finish his exercises in only 10 minutes. And he even stands up, which he was refusing to do previously, and takes some steps. Or think about Brianna, maybe, a 14-year-old patient who has sickle cell disease, and she's in bed for days with almost unbearable pain, throbbing in her arms and legs and back. And the only drug really that helps her at this point is morphine, and so she can barely bring herself to move. But her doctor decides to give her a VR experience for pain relief. And so suddenly she's floating under the sea, and she's transformed, coming to life with a grin, and she's moving around using her hands to reach for whales and dolphins in this undersea adventure. And for 30 minutes, she has this escape from her pain, something to think about different than her pain, a different place to be transported to that doesn't require more drugs.
So again, we ask, why are hospitals considering spending money on this technology? Each person in the stories that David told is getting value from this usage. For Danny and Brianna, they're distracted from their pain and from frustration and stress of the situation. They're able to play like kids again, even just for the moment. Danny accomplished an important rehabilitation milestone, and Brianna felt some semblance of control in a situation where she has very little. Brianna's mom is satisfied because her daughter gets some relief from the unbearable pain without taking pain medication. Brianna's mom is thankful that the hospital is investing tools to give her daughter the best possible care and the best possible experience. Child Life, that's working with Danny, is happy that the AR tool that they're using helped them do their job successfully, but also help move Danny's treatment forward in a non-traumatic way. And Brianna's physician can give her some pain relief without more drugs and is able to provide her with the imaginative play and morale boost that is so important to healing for children. For the hospital administrators at Danny's hospital, they're excited that this AR tool just helped their physical therapist finish the session in 10 minutes so that they can get on to the next patient, and that this kind of great patient experience will translate to higher HCAHPS scores and better stories told about their hospital experience.
So benefits like these are really why hospitals are investing in augmented reality and virtual reality. Because through helping patients like Danny and Brianna in situations like these, Augmented reality and virtual reality are helping to improve the patient experience or reduce the cost of care or reduce trauma for patients, which are all really important outcomes, and a lot more than that, that are very important for providing good patient care and for having your hospital be successful overall. A child life technology expert that I was talking to in the last few months told me we're in the middle of this big wave of virtual reality right now, and augmented reality is another big wave just coming right on its heels. These waves are bringing with them some big opportunities for the hospital, as you heard in these stories, and these technologies are becoming big parts of the medical experience. And it's important to educate yourself so that you and your team don't fall behind. So before we get further, I want to make sure we're kind of all on the same page and give everyone a little bit of a basic working definition of augmented reality and virtual reality. In this session, we probably have people of a lot of different familiarities with these tools, and we're actually going to get a sense of that in a second with a poll, kind of how familiar everyone is. But what are augmented reality and virtual reality, and how are they similar or different? So first, you'll see on the left this example of virtual reality. Virtual reality uses a headset and often headphones to immerse a user in a 3D environment that's complete with sounds. So you're transported to a place very different than the room that you might be standing in or sitting in when you're using it. Augmented reality, on the other hand, uses a camera on a mobile device like the smartphone or tablet, and it adds digital and audio experience over the real world. So it lets you experience both that real world and that digital world at the same time. It puts them together. This is sometimes also delivered, augmented reality, on transparent headsets. Like maybe you've heard of a Google Glass, where you have a transparent lens and then digital information is displayed on top of it. So we're going to get a lot more in depth with each of these tools, and especially how they're being used in hospitals in just a moment. But first, I want to do a quick poll of the group just to see what kind of familiarity our group here today has with AR and VR. So go ahead and get ready to vote in this poll, and we're going to pull this up now. So here's the question for you. The question is, have you tried out augmented reality or virtual reality tools? And you can select one of the following, just pick one of the options and then click submit. All right, we've got votes coming in. About 50% are voted right now. Going to wait another couple seconds to see the rest of them come in. All right, 3, 4, 5 more seconds. We're almost at 80%. Okay. And I'm going to share the results of this poll so you can see. So we have not many actually people have tried an augmented reality tool before. Almost half the group has tried a VR tool, which is great. So a lot of people learning about that. And then a few people, 15% have actually tried both of those, which is really great. And then 36% haven't tried either, which is also really important. So we're glad you're here today learning, and hopefully we can give you a chance to learn at least about augmented reality, get to try out these tools. This is a great place to start learning. So I'm going to hide those and share my screen again. Okay, perfect. So we have a mix of people that have some different familiarity with these tools. And so from this point, let's go just get some background about VR and AR, which will be helpful for everyone, whether or not you've used them before. Let's talk a little bit about kind of where we got to this point where child life people are some of the first in the hospital to be using these cutting edge technologies, AR and VR, and actually using these on a daily basis. So what are the things that have made AR and VR more common in hospitals? These virtual reality and augmented reality have been around for many decades, but in recent years, hospitals have become a lot more willing to adopt these new technologies. And there's a couple of main reasons for that. One of those is that pricing has gotten more affordable. The prices have dropped. It used to cost thousands and thousands of dollars just to get a single virtual reality experience that was maybe really simple in your hospital. And in recent years, it's gotten a lot more cheaper, where with just a couple $100s or a couple $1,000s, your hospital can get started with virtual reality and augmented reality experiences and have really a broad variety of types of things for patients and providers to be using. Another reason is that these experiences now can be accessed on the devices that you hold in the palm of your hand. Augmented reality, virtual reality can both be used with a smartphone and can be accessed on these powerful tools that your hospital already owns. Children also expect more sophisticated experiences now because they might have a tablet at home or a smartphone that they're using. And so 5 years ago, an iPad with a game on it was a really novel distraction that maybe kids had never used before. But now it's taking more sophisticated experiences for them to actually be engaged and distracted. And that's why hospitals are investing in things like these new technologies. And lastly, but really importantly, the usability and accessibility of these tools has only gotten better with time as the companies building them get more experience with design and more feedback on what works and doesn't work in the hospital setting.
So why is child life? We talk to a lot of hospitals, and often child life are the first department or the first people in the hospital to be using these technologies. So why is child life trailblazers? Child life specialists are the patient engagement specialists. They're the experts in the hospital about engaging patients. And so they're always thinking about better ways to engage those children. And so highly engaging technologies are a natural fit. Child life are good early adopters because they're always on the lookout for new ways to capture imagination and attention of patients. They have to stay ahead of patients in that. And they're eager to try new things. Also, child life specialists serve patients across much all departments. So there's a lot of broad application there, a lot of different ways that they can use it in their work. So we've briefly covered what AR and VR are, but now it's time to dive in deeper and learn exactly how these tools are being used in the hospital and how they're helping patients. So we're going to give you some stories and some examples. First, we're going to talk about virtual reality. As a reminder, virtual reality uses a headset and often headphones to immerse the user in a 3D environment complete with sounds. The environment completely covers the user's field of vision. With some systems, the user can interact with the environment in a seemingly real or physical way using special equipment, such as handheld controllers or other types of wearables that allow them to interact with that digital environment. What makes the VR unique is that it's so highly immersive. Since it puts you in a completely different environment, it's very good at distracting your brain. By grabbing all of the brain's attention, the VR experience closes down pathways that would otherwise transfer pain signals from the peripheral nervous system. The more immersed you are, the less pain you feel, and the less you can focus on anxiety or fear.
So what are some of the main uses right now for virtual reality in hospitals? One of the big ways this is used right now is for reducing perception of pain. This could be done in a lot of different situations. It might be used during a painful procedure, so for procedural support like a burn dressing change or a port access or removing a central line. It could also be used outside of procedures in more of a general setting for non-pharmacological pain relief. So for example, for chronic pain or long-term effects from oncology. And because it requires a headset setup, this is often generally a better fit for longer procedures or outside of procedures. So what's an example of this? What does this look like when providers are using VR with their patients? A 9-year-old patient named Blaine, he had a severe injury to his arm while racing a go-kart. And so he had to undergo painful daily dressing changes. And he would actually start screaming and crying before the doctors even got to his arm. And he had to be sedated before they could even get to him because he had so much built-up anxiety from what he'd been going through in treatment. So when virtual reality was introduced, it made a tremendous difference for Blaine. When he used VR before and during the dressing change, he no longer needed sedation, which is a huge step. And during his dressing changes, he went from painful screams to going, wow, I'm in this undersea adventure looking at sea snakes. This is so cool. You have to see this, to the people that were in the room with him. So really a tremendous change. And research also backs up what Blaine is experiencing too. Recent clinical results showed a 24% reduction in pain for patients who reported persistent and daily pain.
Another main reason hospitals use VR is to decrease anxiety and fear for patients. Some use cases are that it can be used before and during a procedure to give the patient something more positive to focus on instead of focusing on the negative aspects. Because it's quick to launch on mobile devices, so a lot of the headsets often use these mobile devices. It can be used for medium or longer procedures. Think about cast removal or distraction during IV starts. Also transfusions where the patient might be sitting for a longer period of time. At the Children's Hospital of Wisconsin, a pediatric psychologist named Jenny Hoag has been working on a study to measure the impact of VR on patients. She had a patient named Jamie who had really struggled before and during his procedures. He'd arrive and immediately feel nauseous and anxious, and he would almost always vomit, sometimes more than once, before the medical team even did anything. Eventually, Jenny introduced VR and was able to help Jamie endure his infusions with a lot less stress, anxiety, and fear and pain. And once Jamie saw that Jenny was right about the VR, he was suddenly much more willing to try her other coping suggestions. And so this is an important thing to note about VR and AR. The end goal should not be about isolating the patient with experiences that help them, disconnect from the real world or tune that out. But it's about providing tools that help them foster deeper connections with the provider and the patient. And Jenny's story is a great example of that. Some of the recent research around VR captures what Jamie experienced, as it showed that VR was especially effective for patients who had high anxiety sensitivity. The study also showed that during blood draws, VR significantly reduced acute procedural pain and anxiety compared with the standard of care. Again, we'll provide links to the research in the AR/VR primer.
So what are some of the benefits and challenges? We've kind of heard some of those woven throughout those stories, but what are some of the benefits and challenges for VR in the hospital? One of the benefits is it's a really highly immersive technology. So if you think about the applications wherever you need really immersive experiences or a high level of engagement, VR is a really great fit, a great tool for that. It's really effective. Because it's so engaging and immersive, it's really distracting. So it's a great high level of distraction tool. And really importantly too, it's fun for patients. If you've experienced VR before, it's a really fun and amazing experience. And this is something that's really important when you're talking about kids in the hospital, maybe there for a long time and making their experience a bit better. So if you're also thinking about integrating these technologies into the hospital, we also want to give you a sense of some of the things that you should be careful about too. Just to be aware of that you'll need to take caution with. One of the things with virtual reality that's a challenge is that for some users it can cause motion sickness. So similar to someone sitting in a car who's seeing scenery go by, and because their body's not moving, their brain senses that disconnect and you start to feel sick. The same thing can happen with virtual reality for some users, not for everyone. So you want to be careful that maybe use caution when you're recommending it to patients, especially ones who are already experiencing nausea from their medication or from their illness. And because VR totally covers the patient's vision, you need to make sure they're in a safe place when they use it, somewhere where they're not going to bump into anything or run into something when they're using it. And generally, they'll need to stay more or less in one place most of the time when they're using VR, since they won't be able to see the objects around them in the room, just for safety. And lastly, the use of VR does require the purchase of a headset, so some hardware. And although the prices are dropping over time, it's still usually around $800 or more per headset. And so even if the price isn't a barrier, it's also important to think about making sure you have someone who can manage that headset and have a sterilization protocol for it. So some challenges to think about, but again, huge benefits and some potential huge benefits it could have for your patients. So we've looked at some of the ways that virtual reality has now been used in hospitals. So now what about augmented reality? And it seems like some of our users are a little bit less familiar with that, at least fewer people having experience with it. So again, as a reminder, what is augmented reality or AR? AR uses the camera on a mobile device like your smartphone or tablet to add 3D digital and audio experiences over the real world and letting you experience them at the same time. So that's part of kind of the magic of AR, is this way you can experience both at the same time. And these are often brought into the real world, these experiences like an animal or a 3D scene in front of you, by having the device's camera recognize a physical item like a card, a trigger item we call it, a card or a book or a decal, when it then puts the item, the 3D experience on that card or that book or that image. So you'll see in this example on the right, you have this card, there's an elephant on the table, the device is recognizing that and it's putting a 3D elephant on the screen. So what makes AR a really unique technology is that it has some of the same immersive elements as VR that are super fun and capture the imagination, but it doesn't require the use of a headset. And so because it puts digital experience over the real world, again, it combines those in a way that you don't really experience with many other things and maybe nothing else in the world. It works on devices that people already own, which also makes it kind of unique technology in that way, like the phones and tablets that even your patients and families carry in with them. And lastly, because it's connected to the real world, it keeps the user, like your patient, connected to the people and the space that are around them, which can be really important in hospital settings, and especially for keeping people connected with their parent or a specialist who's working with them.
So we're going to talk about some of the specific uses of augmented reality. And while it's not completely immersive like VR, as David said, it shares some of the properties. So you're going to hear a little bit of repetition here. But AR reduces the perception of pain. Procedures where AR distraction tools can be used for decreasing pain perception include port accesses, catheterizations, burn dressings changes, a lot of similar ones, but also shorter procedures. Because it's just quickly launching a smartphone or a tablet, you can use it like in blood draws, quick triage moments. So what does this look like? A CCLS named Brindy was called into a patient's room and came in to find a little boy. All right, guys, we apparently were muted. So I'll start the story again. That kind of illustrates the use of augmented reality. A CCLS named Brindy was called into a patient's room and walked in to find a young boy waiting catheterization. And his mom had seen him go through this catheterization before, so she was kind of bracing herself for what was to come. It didn't go so well before. But Brindy pulled out an AR tool to use with her iPad and created a 3D scene in the palm of her hand. The boy was so distracted by the 3D scene that he was smiling and laughing throughout the procedure. And the mother of the boy was shocked to see her son laughing through a procedure that she knew was so uncomfortable for him. There's not a lot of augmented reality research out there about use with patients so far. We're going to talk more in a few minutes about that specifically and how we're contributing to the field. But there was a 2008 study that reinforces what we've been hearing from hospitals. This study looked at the use of AR as an adjunct to analgesia and sedation in children with acute burns who were getting dressing changes. And it found that the mean patient scores, pain scores, were significantly lower in the AR group compared to the control group. And the parent pain assessment scores were also much lower for the AR group.
So another big usage of AR in the hospital is for decreasing anxiety and fear. So child life specialists might use AR tools leading up to or during procedures to keep patients calm or giving them alternate focus so they're not thinking so much about the needle or focusing on their fear or even their parent stress level, which can often add to their own experience of the pain or the stress. So use cases that are common for this, like Christina said, would be infusion prep or IV starts, blood draws. Again, it gives you the opportunity to use it in really quick situations. So what's an example of this? At a Texas hospital, we had a 14-year-old patient that needed to get a blood draw, but she had a needle phobia, which obviously makes this a lot harder. And so the child life specialist used a SpellBound card to distract her during the procedure. And so during that blood draw, this girl was playing with the card and not even paying attention to the needle. The mom was looking at the child life specialist in shock and kind of gesturing how amazing it was. And the child life specialist was trying to just shush the mom and let the girl keep playing with it. And so when they're done, the child life specialist told the girl that we're all done, and she asked, can I keep playing with this? So we actually engaged her so much that she was not thinking about this phobia that she had, and was instead so engaged she wanted to just keep playing with this fun experience for her.
So AR tools are also used in hospitals to motivate patients to move around or do exercises that they may not want to do. So for the repetitive and sometimes painful nature of rehabilitation makes PT and OT, physical therapy and occupational therapy, obviously, perfect use cases for AR. Exercises can be made fun or gamified with AR, and AR is effective at getting both patients and families to get up and walk around. A 7-year-old named Jack suffered a brain aneurysm, and after he emerged from surgery, he had to undergo extensive OT and PT to relearn how to use his hands, arms, and legs. But he often resisted the repetitive and painful exercises he was given and put really his recovery at risk. He was spending a long time in the hospital. Jack's therapists used AR tools to motivate Jack to do exercises that developed his fine motor skills by manipulating and interacting with the digital 3D experiences. The rehab engineer also used AR tools to motivate Jack to reach bigger milestones, like standing and reaching. Jack loved interacting with the 3D worlds and had fun during rehab, meeting his milestones and making it possible to send him home on time. Some hospitals are also investing in bringing their hospital murals or artwork to 3D life using augmented reality to encourage patients and families to get up and move around the hospital, to really create destinations for them to walk to. It's challenging to encourage ambulation, and bringing animals and other types of scenes to 3D life and magically in the hallways is a real enticement for both patients as well as their families to see. They can use their personal devices to experience these.
And last but not least, and again, kind of a thread through a lot of these stories, is that a big value for AR tools in the hospital is building relationships between the provider and the patient, like the child life specialist and the patient, and providing positive ways also for parents to be involved in that experience. So some of the use cases for relationship building would be like a magic trick to get kids to open up when first meeting them. This has been a way that child life specialists that use our AR tools that we were a little bit surprised at, didn't expect, but we hear stories about those pretty often. So building trust and breaking the ice with a patient who's brand new, who hasn't opened up to you yet, to try to build that connection and relationship. And so the way that AR is used on their tablet or phone, again, makes this really easy and a really quick interaction where you're first meeting the child to pull a magic trick out of your pocket. But it also allows patients and parents to view the experience together. And that allows opportunities for them to engage around what they're seeing together, this experience they're having together. So we'll hear stories of this relationship building piece, like a child life specialist using AR tools to draw a patient out who has behavioral and social issues and generally doesn't connect with staff at all. And using those tools to build a connection with the patient, which allows that child life specialist to help the patient get through a lab draw without sedation, which is something that she couldn't do beforehand.
So we're going to cover some of the benefits and challenges of AR. It is immersive, it's also distracting, and like VR, fun for patients and families. They can have a shared experience with AR. A huge benefit is that it works on the devices you already own, probably already have sterilization protocols for, and because it does allow for more movement, it has broad uses and application. There are some challenges, of course. For example, when patients are lying on their back or stomach, it may be challenging to orient the 3D experiences in a way that they can see it when you're using a device like an iPad. Very old iPads may have trouble using AR tools. And AR, when it's used with a mobile device, isn't completely hands-free. So there has to be someone holding or manipulating that device. We're going to talk briefly now about some of the research we're doing to kind of contribute to the field. So we've got 2 research studies that kind of go beyond augmented reality as a distraction therapy tool, and really moving to understand how well augmented reality can engage people with information and increase comprehension of that information, particularly complicated medical concepts. So the first is they're both with the University of Michigan. The first research study is with their health research group. It's studying how augmented reality improves comprehension of complicated medical information. It's a controlled study, and if all goes well, I believe it will have huge implications for prep books or other patient education efforts that are going on in the hospital. University of Michigan is also doing a study on opioid use management in pediatrics. So the question is, can AR enhance risk perception and improve parent decision-making around opioid drug use with their children? This was a National Institute of Health grant, and if all goes well, again, this has huge implications for discharge instructions and outcomes for high-risk treatments at home. We're looking always for partners, so if you think your hospital would like to participate in AR research, please get in touch with us.
So now that you've learned a little bit about these tools, maybe you get to the point where you decide that you want to implement virtual reality or augmented reality for your patients and your team. So we want to leave you with some best practices that we've gotten from our experiences and from the hospitals we work with about how do you really make this a successful implementation. So the first thing I want to point out is that getting team buy-in is really an important part of that process. It's probably the most important part. You want to involve your team, your whole team, if possible, in the evaluation process as much as possible so that if you do make the decision to purchase, then they feel ownership over that. They want to make this a success and they feel committed to the cause. Make sure that you can try out these tools first. Make sure your whole team can try them out. You should be able to get a sample or a trial of these different tools so you can try them out first to see how they how they fit into your workflow, and really get feedback from your team about what are the areas that they're going to be the most valuable and maybe where they're going to be used the least, or where are the biggest opportunities for these tools. Another really important aspect of this implementation success is making sure you have adequate training for your team. And ideally, this should be live, hands-on training. You want your team, when it comes time, kind of crunch time, and they're introducing this tool for the first time to their patient in front of the other medical team and in front of the parents, you want them to feel confident and really be armed with all the information they need so that they can really make that a success and use it well that first time. And if they are not confident that first time, it can also spell not a very good future for them using that tool. They may give up on it. And so make sure to get some training, and in-person is the best. And we know it's difficult to fit, or sorry, not in-person necessarily, but live or hands-on training where they really get to use the tool. And we know it's difficult to fit more training into your day. As you're really busy, a lot of these teams are stretched thin that we're talking to, but training can be as quick as 15 minutes. So it doesn't have to be a long time. It can happen in a staff meeting virtually or something like that, but it's a really important step. And the last thing is just generally make sure to have a plan for how these tools are going to be used. Use that trial and those sample tools to let you use it and figure out where you're going to use it, and then make a plan for how you're going to use them. Sanitizing protocols, where the tools will be kept, who's going to manage them. So much technology gets purchased in the hospital and then unused or underused. So plan for really how to maximize this investment that you're making in these tools.
So great. Maybe you're interested in getting VR or AR in your hospital. How do you pay for it? So we're going to share some of the things that we've heard, ways that we've encountered that teams have been used to get funding for paying for these tools. First, an obvious one is if you're fortunate enough, maybe you have discretionary budget in your own department, and you can start there. And really beginning to understand, how does your department make decisions about the tools that they purchase, and how would this fit into that? We've seen teams find a donor. Hospitals might already have large donor lists, and working with that, you might know specific people to reach out to. But it's also simple things like putting a tool that you're interested in on a wish list. And we've had SpellBound put on wish lists, and people purchase it that way. So you never know who will see it and be interested and reach out. There's also other budgets within the hospital, and so if you can go up the chain in the hospital, show leaders the potential impact in having these tools, and this is why we're providing you some justification tools as well, but budget in other areas. Is there a patient experience budget in the hospital that could apply to this? Are you going to use it in oncology a lot or cardiology a lot, and would they have a budget for this? We helped one of our child life teams get access to a higher budget in the hospital to cover the purchase of SpellBound tools so that it didn't come out of their own budget. And also thinking about construction projects that might be going on that might have very large budgets. Large budgets with very specific goals. Sometimes AR, VR fits well into these goals, and construction budgets can be utilized to cover tools used by clinicians. So for example, a new playroom includes VR headsets, or a new family center, or AR wall decals. A new surgery wing includes hallway murals that trigger AR experiences. Things like that we've seen go through successfully. You guys probably have an experience with foundations. Of course, that's an option, and you can, give them some justification using some of the tools we're giving you today. And applying for grants, either grants that cover technology purchases to improve patient experiences, or you might find a grant that focuses on a particular population in the hospital that fits where you want to use AR and VR tools. For all of these examples, the company that you're working with for the AR or VR can help by providing information to justify the value of it or help you craft a proposal.
Okay, at this time, it's time for our second quick poll. And so get ready to vote. Now that you've all learned some things about VR and AR tools and how these are used in the hospital, I want to launch a poll asking and kind of letting you see what other people in the group are thinking as they're seeing this presentation. So the question is, do you think augmented reality or virtual reality tools are a good fit for the needs of child life teams? So go ahead and select one of those, click submit. Right now we've got 20% voted, shooting up quickly. Give it a couple more seconds. Oh, you guys are great at voting. I think this is better than our nation's voting history in the United States here. So almost 80%.
Good.
All right, we got 80. Perfect. So here are the results. So we have 3% feeling like AR tools or VR tools alone are a good fit for child life, and 8% thinking the AR tools alone are a good fit for child life. And then overwhelmingly, 87% feel like both AR and VR are a good fit for child life. And then a couple that still don't feel that AR, VR tools are a good fit for child life. So again, a bit of a mix, but a lot of people seeing the value here. And I would say, if you're not right now seeing the value for AR and VR, I think that's a good thing. I think some hospitals are just going to have different needs. And so that might be a good thing for you right now to not invest in this technology, or it's just not the right time, or again, there's going to be some areas of the hospital where just struggle to use these experiences well. And so I think that's a really good results, and it shows people thinking through this well. We're going to share our screen again here. And let's see, there we go. Okay, so now that we've talked a bit about how VR and AR are being used in the hospitals, you definitely have a lot more information, hopefully, than you came in with about this at this point. Where's the future of this technology going? Kind of in 5 or even 2 or 5 or 10 years, where is child life or the hospital going to be using virtual reality and augmented reality? So remember how a smartphone seemed like a really kind of crazy experience in 2007 when the first iPhone came out? I remember my first friend getting one and thinking he was crazy for spending all that money. But now it's a very normal, everyday technology. Almost all of us have a smartphone. Most of the patients and families that come into your hospital have that. And technology like AR and VR is probably actually going to have a pretty similar progression. Eventually, these reality tools will be a lot more seamlessly integrated into our everyday lives and other technology that we use. So, but here are some specific areas where we think AR and VR will be big, specifically in the hospital in the future. And one of those is for education. This could be for medical education for training, like for staff members, letting them practice surgeries or procedures, or like a blood draw, having important medical information that's more easily visible during procedures or when you're talking to a patient. And we're thinking about education for patients, kind of like that study that we're engaging with the University of Michigan, helping patients better understand or even visualize complicated medical information that's being given to them. Or in some ways, maybe most excitingly, simulating medical procedures for patients before they're even in the hospital, perhaps. So think about letting kids experience an MRI in a safe way before they get to the hospital. Like they're in their bed and they're looking around, they can see the MRI, they're in their bed at home and can hear the sounds and get used to that. So when they come into the hospital, they have reduced fears and anxiety and may not even need to be sedated anymore for the MRI because they used this experience and got to get used to it at home. So education is a really big area where there's a lot of opportunity for VR and AR in the hospital. Patient experience is another area where there's tons of opportunity, almost endless opportunity for this. And a few big ones I want to highlight would be things like patient rooms being turned into a jungle or some kind of scene, whatever scene that they want. So when they look around them, they feel like they're in this jungle instead of the sterile hospital room that we've been stuck in for so long. And this gives them an element of control too, so they can decide what that hospital should feel like, which is so important for patients. Another option would be collaborative games for patients to play in activity rooms together, or when they're stuck in the rooms, to even be able to play games with other patients in the rooms that are also stuck in the rooms using virtual reality, so a collaborative experience that they can do together. And the last thing would be gamifying the hospital. So turning the patient's rooms and hallways into a custom scene from an augmented reality game that matches the shape of the rooms of the hospital. So it kind of feels like it's real and transforming that space, which helps with patient boredom and getting them up and moving around and just getting that morale boost. And then lastly, but again, this is probably going to be maybe the most common, would be things like everyday things, normal things. They're not going to be crazy usage or flashy things, but tasks that we normally do that will just be easier because we have AR or VR assistants. So we're seeing signs of all these things right now, and we're seeing signs of hospitals changing to reflect this new focus on technology. For example, hospitals are adding positions like patient technology coordinator, sometimes even in child life teams or associated with them. And these positions are about team growth. They're not about cutting people or cutting clinicians, but hospitals are seeing this opportunity to empower their staff with technology to help them do their jobs more effectively. And if hospitals are willing to invest in positions like a patient technology coordinator, we see this as a real sign that the interest in these technologies and the need for them is only going to grow. So given these trends, we think it could be really wise for your team to consider adopting early. For a couple reasons. It will allow you to get ahead of the ball and show your team's innovation and ability to generate extra value when leveraging technology. It will also give you the time to have protocols in place, know how to use it, and know how to get the most benefit from these tools now, because we do see these tools becoming a lot more prevalent in hospitals as time goes by. So we still have one more thing for you, and then we're going to open it up for Q&A. And so I wanted to get a few details out of the way first before we have our finishing challenge and then our Q&A. So first of all is that we do have a special demo pack offer for AR tools, which is a $15 demo package, the lowest price that we've ever offered for trying out our premium tools, and that is just for webinar attendees. So you're going to be able to find it on our website. We're going to send out the code in the follow-up email. You'll get that follow-up email tomorrow. And then we'd love to answer any questions about that trial package and what it includes, but you can find that on our website. And again, it's going to be only available at that price for webinar attendees. Secondly, please fill out the survey that you'll get when you close this webinar. You can tell us how we did, how we can improve for next time, whether you like the matching outfits or not, unintentional. But this is super helpful for us to better serve other child life specialists and offer other great webinars in the future. So please fill out that survey. And then lastly, make sure to download those handouts that we included. So if you click on that handouts tab, if you don't get them now, we'll also have a link in the follow-up email, but I'd recommend clicking on those handouts now. That'll open in your browser and you can download them from there. So with that, here is our challenge to you before we go to our Q&A section.
So 3D technologies like AR and VR are going to play a huge part in the future of healthcare. And we want you to think about what your next step it needs to be. And it's going to be different for different teams. So what's your next step? Right now, do you need to just learn about these things so you can be informed when they might be introduced into your hospital? Does your team need something like AR or VR tools to give your patients a better experience right now? Do you need to lead the charge with AR and VR tools in your hospital if other areas are slow to adapt? Do you need to find funding? I want everyone to leave here and think about their next step, keep it in mind, and let us know if it's something that we can help you with. We know you want to make an impact for your patients, and we also know how important it is to prove the value of child life. And leveraging technology can help you do that. So I think now it's time for some questions from the audience.
Awesome. We'll open it up for you, and Anna's been collecting some questions from the audience for us to respond to. So send those in now too, and we'll open this up so we can see the ones that are pouring in right now.
Okay, we're going to be looking at the questions on the screen over here.
Okay, so first questions. What materials specifically can we use the AR product on? Great question. So for SpellBound products particularly, we have our tools available right now on cards and books. Those could be paper cards for giving away to patients that don't need to be sterilized. We also have plastic cards that can be sterilized and reused over and over again. So you can equip your staff with them that way and have tools to use on a daily basis. And then also on books as well. And so each of those pages of the book has a 3D environment or the scene from the book. It also reads to the child. We're also right now developing, as Christina mentioned earlier, AR wall decals. And those are removable temporary decals you can put on any wall and open up a 3D window to a 3D world. And that's called Magic Portal. So we're approaching right now our pilot phase with a couple hospitals with that to get feedback and then launch that more broadly. But that lets you turn a patient wall or the wall of an activity room or a bland hallway into this window to a 3D world with a scene that you can see inside and kids can interact with. And then the last thing we also do is taking existing artwork in the hospital and bringing that to 3D life using augmented reality.
Mm-hmm. So the question, do you provide products to child life specialists in private practice? Yes. I think, you know, I just because we talk about the majority of child life specialists we encounter are within the hospital system, but we've certainly been working with child life specialists in private practice. So I think reaching out to us and we can talk to you more about how that works, because obviously it's a different way of working with us, but yes, we do.
And is there a way to show us the augmented reality in action? It's a hard concept to grasp without seeing it. What we'll do is we actually won't show it now because that would be pretty complicated, but we'll send you a video in the follow-up email that will show you how that works, so you can see what that looks like. You can also go to our website at spellboundar.com, and it's the end of our email address on the screen there if you just want to take that. But you can also go there, and there we'll have GIFs that show you these in motion, and also you can see videos on our site that show the tool in action.
Do you have suggestions on how to manage a cleaning policy of VR and AR? Well, I think that when we've encountered child life teams, a lot of them already have ways of managing how they sterilize their iPad or phones between patients. And so we kind of took whatever they're using, the sanitation cloths, it could be alcohol-based or bleach-based, there's a lot of different ones that we've encountered, and made sure that our cards work with it. So if there's extra materials to be used with the mobile device, then you do the same thing. In terms of VR, there's certainly groups I know that are working on figuring out how to replace the pads on the headsets that are sitting and resting against the children's face, and the plastic of the headsets can all be sterilized. So it's just about understanding, depending on what tool you choose, which method that you already have in place in your hospital works best for you.
Another question we had, someone says, you mentioned using murals and artwork in the hospital as an AR experience. Can already existing artwork be used? And yes, we can. We've actually done that with one hospital currently. We're close to starting with our second hospital. Right now is starting to take existing artwork like a mural, something the hospital wants to get more value out of and make more even engaging for patients. And we can use that to bring an augmented reality experience that goes with that mural, bring it to life in the hallway or the room for patients and families.
Mm-hmm. So the question is, are people actually billing for the AR/VR experience separate from the procedure it is being used for? If so, is this billing associated with actual reimbursement? I might not be the best person to answer this, but I don't know of cases yet where AR and VR are billable. I think this is probably an evolution that's going to take place, and as the value is proven in different clinical situations, that I think that it will become something that is billable. I could be wrong about VR not being billable yet, but I haven't heard of anything yet.
Yeah, I think often they're probably right now, from my awareness of it, understanding of it, used similar to like child life hours, which wouldn't be billable for the patient, but are a benefit to them. And I think similarly VR and AR are used that way. But if we're wrong in that, someone can let us know and we'll be corrected. Someone else says, we recently purchased a mixed reality headset to use with a gaming laptop. Are there plans to have SpellBound cards experienced in this way? So mixed reality headsets might be something like a Microsoft HoloLens, or if you have another example of those.
Meta. There's a few very specialized headsets that do that, yeah.
Yep. And so the question would be, do we have plans for SpellBound to be experienced that way? We've definitely talked about it a lot, and we have a lot of ideas for things like that could be used. Right now, we primarily build things for, actually almost exclusively build things for tablets and phone experiences. And the reason for that is that most of you have a phone maybe in your pocket right now, and almost all of you have a tablet you're assigned at work that you can use with patients. And so because that's the tools that everyone has on them, that's what we build for. The HoloLens and other kinds of mixed reality headsets, which essentially, again, this just means mixing that physical world and the digital world, so you're seeing the real world but digital information over it. Those are super cool, and they're going to bring up a lot of opportunities in the hospital. But until more hospitals have them, our focus would be building on the tools that the hospital has already, so they don't require additional hardware and things like that. It
isn't difficult, though, to kind of transform those experiences into there. We just want to make sure that when we're doing it and maintaining it, that it's actually getting the usage it needs. So.
Let's see, time for a couple more questions. This question, do you want to read that one?
Oh, sure. What effects do you think this may have on the magical thinking age group of 3 to 5-year-olds? Is there an age suggestion for AR, VR? Yes. So I think what we have always recommended is 4 and up, although I think it's a kind of a fine line between 3-year-olds and 4-year-olds sometimes. I think when a child is old enough to understand the difference between real and imagination is the time when it's best to use it. So sometimes those kids are at 3-year-olds, and sometimes it's with 4-year-olds. I think there's not any studies or anything that's proving the harm in it, but there's not as much magic when the child doesn't understand what they're seeing. So I think that age range would be old 3s and 4-year-olds.
Do you think I'm in the magic thinking age? I'm 27, 28.
Yeah.
I probably missed it. And lastly, how do you train staff on how to use these technologies? So for virtual reality, we don't do that, so we can't answer for that. But for augmented reality, what we typically do with our child life teams that purchase SpellBound is that we do a 15 to 30-minute virtual training. So usually this is during a staff meeting, something like that, when they already have the team together. And then we'll do a training where we lead them through some basic understanding of how the technology works, so they again feel confident explaining this to patients and families. They feel like they are just dangerous enough with knowledge to be able to tell someone about it. And then we also lead them through a live training demo where they can follow along on the cards that they have in their hand. And so they are able to then see what we're doing on the screen and see the experience happening, and then they're also able to follow along and use the cards or books on their own devices while they're watching. So we do that just in a really brief 15 to 30-minute training, and then answer questions and talk about use cases.
I think this is going to be our last question, but remember, we'll collect all the questions that you guys have asked and provide answers, and then send out a Q&A form so everyone can benefit from that. Are there any contraindications for using AR or VR with kids on the autism spectrum? So I'm not going to claim to be an expert here. We've done some research and we've been talking with some groups, so my answer is going to be pretty superficial. Right now, it looks like AR is better suited to work with kids on the autism spectrum disorder in terms of the level of stimulation it provides. We've been looking a lot into figuring out how AR is often a great, when we talk about kids with like social challenges and interacting with clinicians, AR is a great way to simulate that and begin to get them to engage more deeply with the treatment or the protocol around that. It's also, I think, going to be a great tool for things like visual schedules, other ways of getting kids to engage in the everyday world, learning how to perform tasks and do stuff like that. So we think there's going to be a lot of potential and power in the future. And I mean, if anyone with expertise is interested in having more conversations with us, we would love to learn more about that as well.
Awesome. Well, thanks so much, everyone, for joining. We've reached the end of the webinar. And so again, thanks, everyone. We had about 80 people here almost the whole time, which is really amazing. And so thanks for being part of it. Again, make sure to download those resources. If you didn't get them now, you can get them from the follow-up email, which you'll get tomorrow. And then we'll send along the link to the recording and also later the question and answers from today. So thanks again for joining, everybody.
Thank you.
See you soon.
Bye-bye.
Bye.